Chapter 4, Health and Illness. Neither health nor illness is an absolute state. Rather, there are fluctuations along a continuum throughout life. Because it is impossible to be or get or stay well forever, nurses are committed to helping people prevent illness and restore or improve their health. Nurses accomplish these goals by the following: helping people live healthy lives, encouraging early diagnosis of disease, and implementing measures to prevent complications of disorders. The World Health Organization, WHO, is globally committed to health for all. In the preamble to its constitution, WHO defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Each person perceives and defines health differently. Nurses must recognize the importance of respecting such differences rather than imposing standards that may be unrealistic for the person. A person's behaviors are the outcomes of his or her values and belief systems. Values are ideals that a person feels are important, and beliefs are concepts that a person holds to be true. Values and beliefs. Values are ideals a person feels are important, and beliefs are concepts a person holds to be true. Health is a limited resource and valuable possession. Health is a right, and health is a personal responsibility that requires continuous personal effort. Health as a limited resource is a possession that is valuable because its supply is limited and there is no substitute. Given that definition, health is considered quite precious. People often say, as long as you have your health, you have everything, and health is wealth. Health as a right. The U.S. was founded on the principle that everyone is equal and entitled to life, liberty, and the pursuit of happiness. Based on this premise, everyone, regardless of age, gender, level of education, religion, sexual orientation, ethnic origin, social position, or wealth, is entitled to equal services for sustaining health. Unfortunately, as will be discussed later, health disparities exist among various groups within the United States. These groups include the poor, racial and ethnic minorities, and those affected by gender differences, older adults, and people with disabilities. Efforts are underway, however, to eliminate health barriers and to promote equal access to health care per Healthy People 2020. If all are equally deserving of health, it follows that the nation in general, and nurses in particular, have a duty to protect and preserve the health of those who may be unable to assert this right for themselves. Health, a personal responsibility. Health requires continuous personal effort. There is as much potential for illness as there is for health. Each person is instrumental in the outcome. John Pilch, former professor in the Department of Preventive Medicine at the Medical College of Wisconsin, said in his book, Wellness, Invitation to a Full Life, "No one can do wellness to or for another. You alone do it, but you don't do it alone. Nurses stand ready to provide assistance and to advocate on behalf of others." Wellness is full and balanced integration of all aspects of health, physical, emotional, social, and spiritual. Wellness means a full and balanced integration of all aspects of health. It involves physical, emotional, social, and spiritual health. Physical health exists when body organs function normally. Emotional health results when one feels safe and copes effectively with the stressors of life. Social health is an outcome of feeling accepted and useful. Spiritual health is characterized as believing that one's life has purpose. The four components are collectively referred to as the concept of holism. Holism, the sum of physical, emotional, social, and spiritual health, determines how whole or well a person feels. Any change in one component, positive or negative, automatically creates repercussions in the others. Take, for example, the person who has had a heart attack. Obviously, his or her physical health is immediately impaired. In addition, the heart attack affects the emotional, social, and spiritual aspects of health. The client may experience psychological anxiety over this health change. His or her social roles may temporarily or permanently change. The client may explore philosophical and spiritual issues as he or she considers the potential for death. Nurses need to be holistic practitioners because they are committed to restoring balance in each of the four spheres that affect health. They base their strategies for doing so on a hierarchy of human needs. Hierarchy of human needs. In 1954, Abraham Maslow, M-A-S-L-O-W, a psychologist, identified 5 levels of human needs, or factors that motivate behavior, in a book called Motivation and Personality. He grouped the needs in tiers, or a sequential hierarchy, according to their significance. Physiologic is the first level, safety and security the second level, love and belonging the third level, esteem and self-esteem the fourth level, and self-actualization the fifth level. The first level, physiologic needs, are the most important. They are the activities necessary to sustain life, such as breathing and eating. Each higher level is less important to survival than the previous levels. Maslow believed that until a human satisfies his or her physiologic needs, he or she cannot and will not seek to fulfill other needs. By progressively satisfying needs at each level, however, people will realize their maximum potential for health and well-being. Nurses have adopted Maslow's hierarchy as a tool for setting priorities for client care. For example, in the case of the client with a heart attack, the nurse considers the client's physical needs, such as managing pain, as a priority. The nurse addresses other needs, such as assisting the client with a possible change in role performance or spiritual distress after the client's health condition stabilizes. Is the following statement true or false? The first level, physiologic needs, in Maslow's hierarchy of human needs are the most important. True. The first level, physiologic needs, in Maslow's hierarchy of human needs are the most important. Illness. Illness is a state of being unhealthy when disease, deterioration, or injury impairs a person's well-being. Several terms are used commonly when referring to illnesses: morbidity and mortality, acute, chronic, and terminal, primary and secondary, remission and exacerbation, and hereditary, congenital, and idiopathic. Morbidity and mortality. Morbidity, the incidence of a specific disease, disorder, or injury, refers to the rate or the numbers of people affected. Federal statistics are compiled on the basis of age, gender, or per 1,000 people within the population. Again, morbidity is the incidence of a specific disease or disorder or injury and refers to the rate or the numbers of people affected. Mortality, incidence of deaths, denotes the number of people who died from a particular disease or condition. Mortality, incidence of deaths, denotes the number of people who died from a particular disease or condition. During the past few decades, the prevalence of disability among older adults has been gradually decreasing. However, there is growing concern that this trend will not continue or may even be reversed due to increasing prevalence of obesity and low levels of physical activity. Is the following statement true or false? Morbidity denotes the number of people who died from a particular disease or condition. This is false. Mortality is the incidence of deaths, denotes the number of people who died from a particular disease or condition. Morbidity is the incidence of a specific disease, disorder, or injury, refers to the rate or numbers of people affected. Acute, chronic, and terminal illness. An acute illness, one that comes on suddenly and lasts a short time, is one method for classifying a change in health. Influenza is an example of an acute illness. Many acute illnesses are curable. Some lead to long-term problems because of their sequela, which is ill effects that result from permanent or progressive organ damage caused by a disease or its treatment. Chronic illness, one that comes on slowly and lasts a long time, increases as people age. A terminal illness, one in which there is no potential for cure, is one that eventually is fatal. The terminal stage of an illness is one in which a person is approaching death. Primary and secondary illnesses. A primary illness is one that develops independently of any other disease, differs from secondary illness, is a disorder that develops from a pre-existing condition. For example, pulmonary disease acquired from smoking is a primary illness. If pneumonia or heart failure occurs as a consequence of smoke-damaged lung tissue, it is considered a secondary problem. In essence, the primary condition predisposed the smoker, in this case, to the secondary condition. Remission and exacerbation. A remission means the disappearance of signs and symptoms associated with a particular disease. Although a remission resembles a cured state, the relief may be only temporary. The duration of a remission is unpredictable. An exacerbation, which is reactivation of a disorder or one that reverts from a chronic to an acute state, can occur periodically in clients with long-standing diseases. Often remissions and exacerbations are related to how well or how poorly the immune system is functioning, the stressors the client is facing, and the client's overall health status, such as nutrition, sleep, and hydration. Hereditary, congenital, and idiopathic illnesses. A hereditary condition is a disorder acquired from the genetic codes of one or both parents, may or may not produce symptoms immediately after birth. Cystic fibrosis, a lung disease, and Huntington's chorea, a neurological disorder, are examples of inherited illness. The first is diagnosed soon after birth. The second is not manifested until adulthood. Congenital disorders, those present at birth but which are the result of a faulty embryonic development, cannot be genetically predicted. Maternal illness such as rubella, which is German measles, infection with the Zika virus, or exposure to toxic chemicals or drugs, especially during the first 3 months of pregnancy, often predisposes the fetus to congenital disorders. Several decades ago, many pregnant women took the drug thalidomide and subsequently gave birth to infants with missing arms and legs. There is a great deal of concern about the role of alcohol in producing fetal alcohol spectrum disorders, permanent but preventable forms of cognitive impairment, and the effects of exposure to other environmental toxins. Although the etiologies for some congenital disorders are well established, they can occur randomly. An idiopathic illness is an illness of unknown cause. Treatment focuses on relieving the signs and symptoms because the etiology is unknown. Examples of idiopathic conditions include hypertension, for which there is no known cause, or a fever of undetermined origin. Heredity and congenital illnesses are often confused. To avoid this confusion, think genes for hereditary and embryonic for congenital. Healthcare systems. The healthcare system, which is the network of available health services, involves agencies and institutions where people seek treatment for health problems or assistance with maintaining or promoting their health. The healthcare system, clients, and their diseases have drastically changed during the past 25 years. Advances in technology and discoveries in science have created more elaborate methods of diagnosing and treating disease, creating a need for more specialized care. What was once a system in which people sought medical advice and treatment from one physician, clinic, or hospital has now developed into a complex system involving primary, secondary, tertiary, and extended care. Trends in healthcare and health. There is an increased older adult population, greater ethnic diversity, more chronic but preventable illnesses, more older adults with cognitive disorders such as Alzheimer's, decreased incidence of drug-resistant infections, decreased incidence of and death rates from human immunodeficiency virus, HIV, with increased life expectancy associated with expensive drug therapy, expanded application of genetic engineering, treating diseases by altering genetic codes, greater success in organ transplants, reduced barriers for research on human stem cell, efforts to reduce the growth in U.S. care spending, potential for increased health care via health insurance under the Federal Affordable Care Act, more outpatient or ambulatory one-day stay care, shorter hospital stays, less invasive forms of treatment, shift to more home care, greater focus on disease prevention, health promotion, and health maintenance, movement toward self-care and self-testing, approval of more prescription drugs for non-prescription use, greater interest in herbal supplements and other complementary or alternative treatments, nationally linked information systems known as integrative health, computerized medical record systems, shift to criterion-based treatment, clients must meet established criteria to justify treatment measures, and increased litigation against healthcare providers. Primary, secondary, and tertiary care. Primary care are health services provided by the first healthcare provider or agency a person contacts. Usually is given by a family practice physician, a nurse practitioner, or physician assistant in an office or clinic. Cost-conscious healthcare reforms advocate the provision of primary care by advanced practice nurses. An example of secondary care, health services to which primary caregivers refer clients for consultation and additional testing, is the referral of a client to a cardiac catheterization laboratory. Tertiary care are health services provided at hospitals or medical centers where complex technology and specialists are available, may require that a client travel some distance from home. The growing trend is to provide as many secondary and tertiary care services as possible on an outpatient basis, or to require no more than 24 hours of inpatient care. Extended care. Extended care are services that meet the health needs of clients who no longer require acute hospital care. This includes rehab, skilled nursing care in a person's home, or a nursing home and hospice care for dying clients. Extended care is an important component of the healthcare system because it allows earlier discharge from secondary and tertiary care agencies and reduces the overall expense of healthcare. Shorter lengths of hospital stays along with increasing prevalence of chronic conditions in older adults has led to the development of a broad range of extended care services for the growing population of older adults. Healthcare services. As a whole, healthcare services include those that offer health prevention, diagnosis, treatment, or rehab. As the types of healthcare services expand, the healthcare delivery system becomes more complex, costly, and in many cases inaccessible. Children, older adults, minorities, and the poor are likely to be underserved. Many of these people delay seeking early treatment for their health problems because they cannot afford to pay for services. When an illness becomes so severe that the only choice is to seek medical attention, many turn to their local hospital emergency departments for care. Inappropriate use of emergency departments is expensive and involves long waits and often no follow-up care. Access to care. According to the estimates from the National Health Interview Survey in 2014, an estimated 41 million persons of all ages were uninsured. Many of the uninsured live in poverty due to unemployment. Consequently, their access to health care is affected by the economic burden it poses. Financing health care. Government-funded health care. As the number of people covered by an employer's group health insurance has declined, reliance on government plans such as Medicare, Medicaid, and military health care plans such as the TRICARE system has increased. Americans who are uninsured, those without health insurance through their employers, or those who are purchasing health insurance privately can now receive cost-assisted health insurance through health insurance marketplaces that are discussed later. As a result of the Patient Protection and Affordable Care Act, a health reform law passed in 2010, an estimated 11.7 million people acquired health insurance by the end of the enrollment period in 2015. Nearly 11 million more were covered through Medicaid and Children's Health Insurance Program called CHIP, and 5.7 million were able to stay on their parents' plan. Many more were covered through employers who expanded coverage under the Affordable Care Act and on private plans. Despite the major contribution of health insurance programs in paying for healthcare services, out-of-pocket expenses have been steadily increasing for older adults. Medicare is a federal program that finances healthcare costs of persons aged 65 years and older. Permanently disabled workers of any age and their dependents, and those with end-stage renal disease, is funded primarily through withholdings from an employed person's income. Medicare has various components, Parts A, B, C, and D, of which the latter three are optional, B, C, D. Part A covers acute hospital care, rehab care, hospice, and home care services. Part B is purchased for an additional fee and covers physician services, outpatient hospital care, laboratory tests, durable medical equipment, and other selected services. Although Medicare is primarily used by older Americans, it does not cover long-term care and limits coverage for health promotion and illness prevention. Part C, Medicare Advantage, is a Medicare-approved private health insurance plan that provides all of Parts A and B of Medicare, plus additional benefits such as vision, dental, hearing, and many include prescription drug coverage. Medicare Advantage can potentially save money because out-of-pocket expenses may be lower than with Medicare Parts A and B. Part D includes prescription drug coverage. Medicare Part D became available in 2006. It provides a means of relieving the financial burden of an older American and those with low incomes and disabilities who require prescription drugs. Everyone eligible for Medicare can receive prescription drug coverage regardless of income, resources, health status, or current prescription expenses. Nevertheless, a coverage gap, sometimes referred to as the donut hole, remains. People are being advised to compare Medicare benefits with Medicare Advantage plans offered by private companies. Some may choose to purchase an additional Medigap insurance plan to assist with the cost of deductible and copayments to supplement their Medicare coverage. Medicaid is a federally funded, state-administered healthcare program for low-income individuals. There is no required payment of premiums or deductibles for individuals who qualify for Medicaid based on personal income and assets. Healthcare providers who accept Medicaid cannot bill for any additional charges. Each state determines how the funds will be spent. In general, Medicare programs cover prescription drugs, eyeglasses, preventive care, hospitalization, diagnostic tests, physician visits, rehab, and outpatient care. However, coverage for healthcare services varies among states. The CHIP program is another national insurance program. It is designed to cover expenses of uninsured children who are not eligible for Medicaid. Is the following statement true or false? Part B in Medicare is purchased for an additional fee and covers physician services, outpatient hospital care, laboratory tests, durable medical equipment, and other selected services. This is true. Part B in Medicare is purchased for an additional fee and covers physician services, outpatient hospital care, laboratory tests, durable medical equipment, and other selected services. Let's discuss health insurance marketplaces first. Health insurance marketplaces are state organizations that provide a means for individuals or employers with small numbers of employees to purchase affordable private health insurance under the provisions identified in the ACA. Insurance purchased through a marketplace lowers premiums and out-of-pocket costs for people with lower modest incomes by providing financial assistance subsidies. For states that have not yet established a marketplace, individuals can purchase a plan administered by the federal government. Financing health care. Historically, private insurance, self-insurance systems, and Medicare paid for health care. Hospitals and approved providers received payment for what they charged. More charges increased income and profits. These plans offered no incentive to control costs. Disparities in access to health care and the high cost prompted evaluation of the entire healthcare system. This led to innovative cost-cutting approaches in government payment systems and those financed by private insurers and corporate health plans. Prospective payment systems. In response to escalating healthcare costs, the federal government implemented a system of prospective payment in 1983 for people enrolled in Medicare. A prospective payment system uses financial incentives to decrease total healthcare charges by reimbursing hospitals on a fixed rate basis. Reimbursement is based on the diagnostic related group, DRGs, a classification system used to group clients with similar diagnoses. Since its inception, the DRG, Diagnostic Related Group system, has been largely responsible for marked decreases in hospital lengths of stay. Managed care. Managed care organizations, private insurers who carefully plan and closely supervise the distribution of their clients' healthcare services, control costs of healthcare, and focus on prevention as the best way to manage costs, using the following: using healthcare resources efficiently, bargaining with providers for quality care at reasonable costs, monitoring and managing fiscal and client outcomes, preventing illness through screening and health promotion, providing client education to decrease the risk for disease, and minimizing the number of hospitalizations for clients with chronic illness. The two most common types of managed care systems are health maintenance organizations, HMOs, and preferred provider organizations, PPOs. Capitation is the third emerging MCO financial strategy. Health maintenance organization, HMOs, are corporations that charge preset, fixed, or yearly fees in exchange for providing health care for their members. The fee remains the same regardless of the type of health service required or the frequency of care. These organizations are able to remain fiscally sound because they offer preventive services, periodic screenings, and health education to keep their members healthy and out of the hospital. HMOs provide ambulatory, hospitalization, and home care services. Some HMOs have their own health care facilities, others use facilities in the community. A member of an HMO must receive permission for seeking additional care, such as a second opinion from specialists or unauthorized diagnostic tests. Those members who fail to do so are responsible for the entire bill. In this way, HMOs serve as gatekeepers for healthcare services. Preferred provider organizations, PPOs, are agents for health insurance companies that control health costs on the basis of competition. PPOs create a network of a community's physicians who are willing to discount their fees for service in exchange for steady supply of referred clients. The subscribers' clients can lower their health care costs by receiving care from any of the preferred providers. If they select providers outside the network, they pay a higher percentage of the costs. Capitation. An approach that is fundamentally different from HMOs and PPOs is capitation, a payment system in which a preset fee per member is paid to a healthcare provider, usually a hospital or hospital system, regardless of whether the member requires services. Capitation provides an incentive to providers to control costs and services as a means of making a profit. If members do not receive costly care, the provider makes money. Outcomes of structured reimbursement. Before that, controlling escalating health costs, which we just discussed, prospective payment systems, health maintenance organizations called HMOs, preferred provider organizations called PPOs, and capitation. Outcomes of structured reimbursement. In many cases, the changes in reimbursements have shifted economic and decision-making power from hospitals and physicians to insurance companies. One criticism is that it is difficult to obtain and provide health care without the economic pressures of insurers. Many claim that the profits of insurance companies come at the expense of quality care. For example, hospitals are using unlicensed assistive personnel to perform some duties that practical, vocational, and registered nurses once provided. Current evidence shows that deaths in healthcare agencies increase as the numbers of licensed nurses decrease. On the other hand, cost-driven changes have had positive effects as well. As concern for cost meets concern for quality, healthcare institutions, nursing personnel, and other providers search for ways to ensure that all care, teaching, and preparation before the discharge date occur without overusing expensive resources. In an attempt to reduce duplication of healthcare services and to increase revenue, hospitals and other healthcare facilities are forming networks known as integrated delivery systems. They offer a full range of healthcare services in a highly coordinated, cost-effective manner. They offer diverse options to clients and result in shorter hospital stays, fewer complications such as hospital-acquired infections, and quicker return to self-care. National Health Goals, Healthy People 2020. An ongoing professional national health promotion effort referred to as Healthy People 2020 is a continuation of the 1979 Surgeon General's report Healthy People and later Healthy People 2000 and Healthy People 2010, and now the mission of Healthy People 2020 and its four main goals for promoting the nation's health in the 21st century are aimed at improving the quality of life, not just increasing life expectancy, identifying major factors that affect health and wellness, setting public health priorities, and achieving health equity among the nation's citizens. Healthy People 2020's four main goals are subdivided into multiple topics, each of which has identified interventions that consist of programs, policies, and information, determinants that identify social, economic, and environmental factors and individual traits and outcomes, such as behaviors, specific risk factors, diseases, mental disorders, disabilities, injuries, and qualities of life. Examples of targeted health goals for achievement are as follows. Increase the proportion of people with health insurance in the health professions, allied and associated health professions, and nursing. Increase the proportion of all degrees awarded to members of underrepresented racial and ethnic groups. Increase the proportion of health and wellness and treatment programs and facilities that provide full access for people with disabilities. Reduce the number of new cases of cancer as well as the illness, disability, and death caused by cancer. Reduce infections caused by key foodborne pathogens. Improve the visual and hearing health nationally through prevention, early detection, treatment, and rehabilitation. The Healthy People 2020 campaign is carried out with the combined expertise of the Public Health Service, each state's health department, national health organizations, the Institute of Medicine of the National Academy of Sciences, and selected individuals from the public at large. To meet the targeted goals, healthcare providers are challenged to implement strategies to improve the overall health of people living in the U.S. The goal of the nursing team, personnel who care for clients directly, is to help clients attain, maintain, or regain health. Healthy People 2020 mission and goals. Mission: identify nationwide health improvement priorities, increase public awareness and understanding of the determinants of health, disease, disability, and the opportunities for progress, provide measurable objectives and goals that are applicable at the national, state, and local levels, engage multiple sectors to take actions to strengthen policies and improve practices that are driven by the best available evidence and knowledge, identify critical research, evaluation, and data collection needs. Goals: attain high quality, longer lives free of preventable disease, disability, injury, and premature death. Achieve health equity, eliminate disparities, and improve the health of all groups. Create social and physical environments that promote good health for all, and promote health development and healthy behaviors across every stage of life. Nursing team. The nursing team primarily includes the client and nursing personnel, but it may also include several types of professionals as well as allied healthcare providers with special training such as respiratory therapists, physical therapists, and technicians. Nurses in particular use their unique skills in the hospital as well as other employment areas. Because they have skills that assist the healthy, the dying, and all others in between, nurses work in various settings such as HMOs, physical fitness centers, weight loss clinics, public health departments, home health agencies, and hospices. Wherever nursing personnel work together, they use one of several patterns for managing client care. The 5 common management patterns are functional nursing, case method, team nursing, primary nursing, and nurse-managed care. Each has advantages and disadvantages. Nursing students are likely to encounter one or all of these methods in their clinical experience. Functional nursing. One method used when providing client care is functional nursing, a pattern in which each nurse is assigned specific tasks. For example, one is assigned to give all the medications, another performs all the treatment such as dressing changes, and another works at the desk transcribing physician's orders and communicating with other nursing departments about client care issues. This pattern is being used less often because its focus tends to be more on completing the task rather than caring for individual clients. Case method. This is a pattern in which one nurse manages all the care a client or group of clients' needs for a designated period of time. This should not be confused with managed care, which is discussed later. The case method is most often used in home health, public health, and community mental health nursing. Nurses who develop this type of care are referred to as case managers. Again, case method is a pattern in which one nurse manages all the care a client or group of clients need for a designated period of time. This should not be confused with managed care. The case method is most often used in home health, public health, and community mental health nursing. Nurses who deliver this type of care are called case managers. Team nursing is a pattern in which nursing personnel divide the clients into groups and complete their care together, is organized and directed by a nurse called the team leader. The leader may assist with, but usually assigns and supervises the care that other team members provide. All team members report the outcomes of their care to the team leader. The team leader is responsible for evaluating whether the goals of the client are met or not. Conferences are an important part of team nursing. They may cover a variety of subjects but are planned with certain goals in mind, such as determining the best approaches to each client's health problems, increasing the team members' knowledge, and promoting a cooperative spirit among nursing personnel. Primary nursing. In primary nursing, there is a pattern in which the admitting nurse assumes responsibility for planning client care and evaluating the client's progress. The primary nurse may delegate the client's care to someone else in his or her absence, but is consulted when new problems develop or the plan of care requires modification. The primary nurse remains responsible and accountable for specific clients until they are discharged. Nurse managed care, another type of nursing, is a pattern in which a nurse manager plans the nursing care of clients based on their type of case or medical diagnosis. A clinical pathway typically is used in a managed care approach. Nurse managed care was developed in response to several problems affecting healthcare delivery, such as the nursing shortage and the need to balance the costs of medical care with limited reimbursement systems. Nurse managed care is similar to the principles used by successful businesses. In the business world, corporations pay executives to forecast trends and determine the best strategies for making profits. In nurse managed care, a professional nurse evaluates whether predictable outcomes are met on a daily basis. By meeting the outcomes in a timely manner, the client is ready for discharge by the time designated by prospective payment systems, if not before. Pilot studies indicate that this approach ensures that standards of care are met with greater efficiency and cost savings. Hospitals that are adopting nurse managed care report that they are operating within their budgets and decreasing their financial losses. Continuity of care, maintenance of health care from one level of health to another and from one agency to another, ensures that the client navigates the complicated healthcare system with a maximum of efficiency and a minimum of frustration. The goal is to avoid causing a client, whether healthy or ill, to feel isolated, fragmented, or abandoned. All too often, this occurs when one healthcare provider fails to consult or communicate with others involved in the client's care. Chapters 9 and 10 in TIMBY give examples of how nurses communicate among themselves and with personnel and other institutions to ensure that the client's care is both continuous and goal-directed. The Joint Commission requires discharge planning at the time of a client's admission to ensure that any additional healthcare services are pre-planned when the client transitions to another level of care. And this is the end of the slideshow.